COVID-19 Safety 101 Beyond Sanitizing for Reopening the Hospitality Industry, presented by VidaShield. Employees across the entire hospitality industry report feeling vulnerable to COVID-19 because their jobs require being too close to coworkers and customers to meet social distancing guidelines from health authorities.
One of the top questions we see from you: how does the coronavirus spread? Scientists are revealing new answers every day. The main method is when an infected person coughs or sneezes, sending out droplets into the air. Early research showed those droplets could travel up to 6 feet, but a new group of researchers thinks it could be even further. Take a look at this. This is a model they created that shows what happens when you cough in a place like a grocery store. Look at that. Look at how the cloud spreads. The researchers say an infected person could cough and walk away, but they leave behind small particles carrying the virus, which can end up infecting others. And those particles can live in the air for a while. Researchers at the National Institutes of Health, the CDC, UCLA, and Princeton found the virus can live in the air for about 3 hours. On plastic, it can live for 3 days. The same with stainless steel. On copper, 4 hours, and on cardboard, up to 1 day.
The country is preparing to reopen as new COVID-19 cases subside and state and local governments relax restrictions. Steps toward reopening. U.S. businesses, along with city, state, and federal government, have formed committees to identify and implement enhanced protections for returning staff and customers. The hospitality industry is taking measures to provide low-contact service for guests and team members. Guest rooms, restrooms, kitchens, lounges, and fitness areas are of primary concern. Areas of concern within commercial and Native American casinos include lobbies, public areas, food service, dining rooms, casino areas, slot machines, and back-of-house offices. When exposing microorganisms to UVC light, the light penetrates through their cell wall and disrupts the structure of their DNA molecules, prohibiting reproduction. UVC has been used in healthcare for decades to reduce aerosols containing pathogens. The VidaShield UV24 system uses UVC and filtration to draw in and treat environmental air.
Why not consider the air? Doctors wear masks during surgery. Dental hygienists wear them during routine procedures. There is risk of spreading C. diff from simply flushing a toilet. UV has been used as a disinfection tool for decades in healthcare, but the challenge with UVC technology has always been the method of delivery. It can't be used in occupied spaces and is only effective in areas that are direct line of sight. Until now. That is exactly what makes VidaShield different. Operating 24/7, 365 in occupied spaces, VidaShield is a fast, continuous UVC air purification system that reduces the levels of bacteria and fungi in treated air and reduces the settling of viable bacteria and fungi on surfaces. Healthcare staff have reported improved indoor air quality and reduced odors.
Every 15 minutes, 99.99% zonal protection is achieved for a 10-foot by 10-foot by 8-foot space, during which 80% zonal protection is achieved for a 24.5-foot by 24.5-foot by 8-foot space. That equals 6 times the air volume.
Air is the vehicle by which many harmful microbes travel, contaminating surfaces along the way. Studies prove that hospital air can be a route for pathogenic aerosols, so if you can reduce contamination in the air, you can fill an important gap in your infection control processes. VidaShield is an engineering control which reduces bacteria and fungi by drawing dirty air in with a set of fans, passes it through a shielded UVC chamber, then pushes clean, treated air back out into the room. Even though hospitals address surface contamination through accepted protocols based on episodic cleaning, the risk of contamination still increases during the time between cleanings. VidaShield fills the gaps of episodic cleaning by providing continuous air treatment.
The patented VidaShield is an active system that draws microorganisms to a UV light. There are 2 vents on the face of the fixture. Behind one is an array of fans which draws air through a MERV6 filter, which removes larger particulates of dust. Air is pulled through the filter into the UV chamber mounted on the back of the fixture at approximately 50 cubic feet per minute. It can treat a volume of air equivalent to a 10 by 10 by 8 foot room, 4 times per hour. The air moves through a set of safety baffles which prevent the UV light from escaping the chamber. Once in the chamber, a high-intensity UV lamp operates at the peak wavelength of 253.7 nanometers. The air is then pushed through an opposing grill at a 30-degree angle to promote circulation of the treated air throughout the room. Once VidaShield is installed, it requires no engineering controls to operate and minimal maintenance, which helps keep operational costs low.